it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today let's talk about the difference between BiMax PROTRUSIVE and BiMax RETRUSIVE. And I've made a few other BiMax videos, but I was only referring to PROTRUSIVE. So let's talk about the difference and how you diagnose this and how this affects your treatment planning. So obviously, most orthodontists are pretty good at looking at faces and looking at cephalometric x-rays, and we can kind of tell. We don't even need numbers. But for the most part, if you do run numbers on a cephalometric x-ray, your BiMax RETRUSIVE cases, and let's take a step back. BiMax means both jaws, upper and lower. Okay, bimaxilla, upper jaw, lower jaw. RETRUSIVE means that both jaws are set back relative to the cranial base. That often means and is associated with a smaller airway, not always. And possible airway problems. BiMax PROTRUSIVE means that both jaws are set forward. Absolutely nothing wrong with BiMax PROTRUSIVE. It often is also associated with flared incisors because, things are just forward. Not a problem. Sometimes these protrusive ones can seem very full. The patients may have a chief complaint that they feel like their lips are too full or that their face is too full, and they may not like the profile. Definitely, whenever I have a BiMax PROTRUSIVE case, I like to open that conversation up if it's a kid with the parent, but it's a very delicate conversation. Now remember, these norms are set on norms that were mostly derived from a Caucasian population back in the studies in the 40s and 50s. So certain ethnicities are going to have more protrusive tendencies, and there's absolutely nothing wrong with that. As long as the soft tissue and musculature is able to adapt around it, as long as they are not mouth breathing, as long as they are not, having speech issues or issues closing their mouth during the day or at night, nothing wrong with BiMax PROTRUSIVE as long as the patient and the parent, or just the patient, if they're over 18, are happy with the profile. As a matter of fact, if they come in with BiMax PROTRUSIVE, and as long as I don't see any issues with open bites or mentalis strain or any signs that there might be mouth breathing, I'm probably not even going to mention it. Or I may mention that your jaws are set a little more forward. That's actually a great thing. I love the look. Are you cool with the look? Or are you looking for a more backwards look? And occasionally they will say that. But worst thing you want to do is just go off the numbers and just insult someone for having protrusive maxilla and protrusive mandible. Nothing wrong with that as long as they're in sync and good class 1. Now, BiMax RETRUSIVE is a problem because often it comes with a smaller airway. Often it comes with crowding, and there isn't enough space to fit everything in. We want to try to fix that. We want to try to move things forward as much as possible. We definitely wouldn't want to move things back in a BiMax RETRUSIVE case. This would not be a case for sequential distalization. This may be a case for sequential distalization. So treatment plans, of course, need to be forward-thinking, forward-focused. I love doing expanders on these cases. Usually and often the upper jaw can pop forward a little bit when you do an expander, helping the airway out. Sometimes once you pop the maxilla forward, the mandible was just trapped and it swings and auto-rotates forward and boom, problem solved. Sometimes we can't fix it, but definitely pulling out premolars on a retrusive case is a big no-no in my opinion. That's a definite no-no, whereas less of an issue here. So just keep that in mind. And again, the points I'm looking at, because I use the Steiner analysis for my cephalometric x-rays, the points I'm looking at are SNA and SNB, and then relative to one another is A and B, but you may use a different cephalometric x-ray. But that's the points I look at, and then I look at relative to the norms, relative to the patient's age, relative to the patient's ethnicity. Make sure you have all that data. You can't just trace it because tracing means nothing in a vacuum. All right, thanks so much.